Good afternoon, everyone, and thank you for joining us. I'm Huei Ong, founder and CEO of January Health Company. I started this journey because of my own postpartum experience. Despite having worked in healthcare, I still found myself Googling symptoms at 3 in the morning, trying to navigate all of the different specialists that I was not familiar with, all with no family close by. And oh, by the way, I was also trying to take care of a newborn for the first time. It felt like postpartum was really treated as one single 6 week checkup rather than this complex months long transition it actually is. And it was so jarring after having seen my provider like 12 to 15 times throughout my entire pregnancy journey. That's why I founded January. We want to provide personalized support for postpartum, perimenopause, and beyond, providing coordinated care with our virtual concierge team for the transitions that women feel like they have to navigate alone. We want to be your trusted partner you can reach out to, who is in your corner, check in often, and offer support where we can. So today we're focused on busting major postpartum myths with two incredible experts that I'm so excited to join us on the panel today. First, we have Dr. Lena Fan, who is our Chief Medical Officer. She is a board certified endocrinologist with a strong focus in women's health. In addition to seeing patients, she is also a researcher and teaches endocrinology, bone disease, and diabetes. We also have Brittany Coffman, who's a certified professional midwife and a physician assistant. She's been serving families since 2007, integrating clinical training with evidence-based midwifery care throughout pregnancy, birth, and postpartum. So what we wanted today is talk through all these postpartum myths, because believing a lot of these would only make recovery harder and more isolating than it needs to be. So let's dive right in. The first myth is you'll bounce back to normal in 6 weeks. Dr. Fan or Brittany, do you want to take this?
Yeah, so I think this is one of those numbers that a lot of women assume is the normal because they usually have a 6 week postpartum follow up with their OBGYN. But statistically, and a lot of the research shows that complete postpartum recovery for most women take about 12 to 24 months. So it's a lot longer than the usual 6 week benchmark that a lot of women may think it may be. And there is good research that shows that a lot of women, even by 3 to 6 months postpartum, 50% of women don't actually feel like they fully recovered. Bounce back is a myth, and it takes however long it takes for each individual mom to recover. We strongly encourage at January to kind of really tailor that postpartum recovery experience to whatever your body needs, and to really listen to your body, because there is no one number fits all in terms of the number of weeks that women need to recover. And it just really depends on what your journey looks like. So that's one of the things that we really want to concentrate and focus on here.
Yeah, so important.
Let's go to our next myth. If you're not bonding immediately, something is wrong with you. Brittany?
Yeah, that's a really great one early in this webinar as well, because it is such a common concern. Bonding is a process. It is absolutely not a single moment, and delayed bonding can be very common. In my experience, probably about a third of women, if we had perfect, healthy bodies that had no issues, if we had healthy coping mechanisms from our past, if we had an uninterrupted birthing process, we would lean into more being able to have this normal cascade of hormones that's happening. But things like birth trauma, right? Exhaustion, tell me who isn't exhausted in their first labor, mood shifts, they can really interrupt this normal process. And so what we're talking about here is this love hormone called oxytocin. I don't know if you've heard of it. And this hormone facilitates this bonding. And this bonding can evolve over weeks as trust, familiarity, and caregiving is building, right? To give you an example, a lot of people picture it that that their baby is born, right? They see them for the first time and they want cosmic stars happening right in the horizon. And sometimes bonding is like a 3 week old or 3 month old baby. You're up at 3 a.m. tending to them. And then all of a sudden you finally get this hormone rush, right? That people were predicting. The thing we know is that delayed bonding does not predict for long-term attachment, has nothing to do with it. So your bonding might happen anytime, and that's normal. Things that we can do to facilitate more of these feelings that we want are things like skin to skin, right? This facilitates great hormone transfer between you and baby. And what I mean by that is like you have no top on, no bra, no tank top, nothing, and baby has only a diaper, and you guys are fully chest to chest. Also, responsive caregiving and a supportive environment that the parents are in, that does facilitate increase in bonding. So those are some things that you can do to kind of increase this oxytocin hormone to happen more. And we also want to think about when we should seek help, when we don't think that this bonding is happening in an appropriate timeline. That would be persistent disconnection, maybe intrusive thoughts or functional impairment, right? That's when we want to seek out providers' support. Just know, I guess I'll end on, if you're having trouble with bonding or you feel like this is you that I'm speaking to, that you should be patient and seek help when you need it.
Yeah, this one is so interesting to me because I agree with you, Brittany. I think a lot of women go into birth thinking that when the baby comes out and you hold them for the first time, you're going to see stars and hearts. But the reality is it was such a different and new experience, and your body's going through this huge shift that when I talk to a lot of women, the word that they use commonly is they felt disassociated almost from the moment. And it's okay. It does take time. And to that end, I think this is also really tied nicely to the next myth that we want to talk through, which is postpartum depression only happens in the first few months. Lena, do you want to take this?
Yeah, this is an incredibly important and topic for a lot of postpartum moms. What Brittany had kind of alluded to is that there is a very kind of expectation versus reality disconnect when it comes to immediately postpartum. Some moms do feel immediately connected to their child immediately postpartum. And then for some moms, it just takes time. And then the question is, does that lack of connection or that new disconnection become concerning for moms? And this is where this myth of postpartum depression only happens in the first few months. And then that's technically not true. The postpartum depression can happen at any point in time, definitely in the first year of postpartum. And we know that based on research, peak onset of postpartum depression happens actually 4 to 6 months postpartum. So not technically in the first few months, actually, when people think they're actually in the groove of taking care of their child. And at some point, a disconnect may happen. But 40% of cases do develop within the first 3 months postpartum. So that is a very vital transitional time for a lot of moms. A lot of things come into play. A lot of that is exhaustion from transitioning to this new role, lack of sleeplessness, maybe pre-existing depression, anxiety, and the mom's personal medical history. Sometimes it may be the transition back to work, because some moms do transition back to work around that 3 to 6 month mark. And that adds a lot of stress to these new moms. And then sometimes it's just the hormonal transitions, breastfeeding, weaning from breastfeeding, that adds a lot of stress to this transitional period of time. So I think the key takeaway is that when you don't feel like yourself, and it is really impairing how you can take care of yourself and how you can take care of your baby. And if you're having intrusive thoughts where it's starting to really become unsettling and scare you, please never hesitate to reach out to your providers, whether it be your primary care physician, if you're still in touch with your midwife at that time, or definitely your OBGYN. It's an important kind of thing to just keep in mind. It doesn't happen to everyone, but it happens to enough of moms that it is an important myth to dispel.
And another myth that I remember hearing a lot about during pregnancy is you should sleep now. Really sleep now, or sleep when the baby sleeps, because you're going to be sleep deprived after the baby comes, and it's just part of motherhood and it never ends. But what do you say to patients who are thinking about this and worried that they're never going to go back to normal sleep again?
Yeah. Well, I mean, the reality is that some level of sleep challenge is within normal, right? And stating it in such like a simplified manner really doesn't do mothers any favor. Society will bombard us with these types of comments, especially pregnant. I don't know why we always want to talk to pregnant women in the middle of the grocery store. It doesn't do us any favors. And while sleep deprivation might be, some form of it might be normal, we should be always seeking to reduce the effects of this. Saying things like you'll adapt makes families think that it's something that they should deal with instead of something they should kind of work against, and they could take an active role in it. It's not just something that like it has to happen and we just have to sit there and let it happen. It's not something to accept and ignore. That's what makes this statement a fallacy. You don't just deal with it, right? But also, I've never met a mom postpartum who wasn't tired, right? Chronic sleep deprivation is not normal. it can significantly affect healing, mood, cognition, milk supply, all the things that are important at this stage. It also increases the risk of postpartum depression, as Dr. Lena was talking about, anxiety, which is related, and impaired immune function, which is important, especially as we're heading into these winter months and we have newborns. Recovery of all of these different factors depends on adequate REM sleep, right? So this includes tissue repair, which is important after childbirth. In preparation for birth, then we want to shift from this adapt mindset, right, of this myth to strategize. Things like shared nighttime duties, short daytime naps, leaning into a supportive network, set yourself up for success, have a therapist ready and on standby that you've already met to help you process emotions, set us up for like recovery postpartum for things like acupuncture, massage, pelvic floor therapy that I hope we get more into talking about soon. Inquire for postpartum recovery from a midwife who can do frequent check-ins, right? After we leave the hospital, especially for those 2 to 3 days, who are we talking to after that really makes a difference. And if you don't have a network of supportive people now and you're pregnant, maybe set up some time to make new connections. We don't always have a plan for postpartum women. And that's where we're going wrong. We need to make a plan for your partner. We need to make a plan for your work. We need to make a plan for your responsibilities so you can truly let them go. And I have a few helpful hints that I talk about when we talk about sleep. Try to refrain from having visitors postpartum for the first 24 hours. Okay. For the first 24 hours, no visitors. I know everybody wants to come, let it go. Just tell them that your provider said that you need to have a moment and rest and heal. Blame it on us. And then the second thing is for at least the first 2 weeks postpartum, I always recommend to my clients that they have like a 2-hour window for visitors, let's say 2 to 4 p.m. And what that does is it prevents lots of little visits throughout the day that are really interrupting that ability to rest and nap and get breastfeeding going if that's something you're interested in. It prevents that like filling your day up with different windows of small visits. And then lastly, I'll add if people are visiting you in the first 2 weeks postpartum and you don't feel comfortable being in your robe or in your pajamas with them, then they're probably not in that inner circle and should be visiting for the first 2 weeks. And those are some things that I want you to think about when you're thinking about sleep deprivation is that we're going to strategize. We're going to make some plan. And maybe part of that plan is saying no, okay, which a lot of us have trouble with.
That's a really good point. I think a lot of us forget that no is a complete sentence with a period at the end of it. And it is okay for it to just be one word and a period, and that is it.
No. Yep.
Yeah. No
Yeah.
explanation needed.
Get good at it postpartum. Let's go.
I wanted to like just double down on the part you were talking about,
Mhm.
partners, it's like, and visitors, getting on the same page with your partner or that inner circle on what
Mhm.
your visiting hours or policy is I think so
Yeah.
important to get done before you have the baby, because in all of the chaos, you just don't have time to discuss it.
Right.
Yeah. Yeah.
Absolutely. And it's an evolving kind of like situation, right? So you may choose at 2 weeks to feel like, actually, no, I don't want any more visitors anymore. I just want to take some time to just focus on yourself when peak sleep deprivation is high, because the cortisol and all the high of just post delivery and kind of the stress of making sure the baby stays alive starts to wear off and the fatigue starts to settle in. So I think it's always an evolving process, and no is definitely a complete sentence. And that is what we would really emphasize here.
I like it.
I love it. So I know in the last couple of myths, we've been talking a lot about quality of life or your mental well-being. I wanted to switch gears a little bit to talk about some of the more physical aspects relating to pregnancy and postpartum. This myth here, postpartum complications only happen to high-risk women. So we know the US has one of the highest maternal mortality rate, but did you know that 60% of that actually occur postpartum and not just 6 weeks between month 1 to month 12 of after having a baby? And I think for a lot of us, obviously, we don't think about this because we don't want to think about these high risk situations. But also, I feel that we've had a smooth pregnancy. We feel like, well, I'm healthy. I exercise, I get enough sleep. I went to all my appointments. Delivery was smooth. I think I'm in the clear now. How do you dispel that myth?
Yeah, that's a really good question. I think it's hard because I feel like with the internet and all this research that women can do to prepare for their pregnancy and to make sure they dot their I's and cross their T's, it gives a lot of us a kind of, well, I don't want to call it a false sense of security, but a sense of security that we've done as much of ourselves, as much research and as prep work to prepare ourselves to feel like we're in the best case scenario and we've put ourselves in the best situation to succeed, pregnancy, delivery, and postpartum. But I think there's some things in terms of postpartum complications where unfortunately it can happen to anyone. And regardless of how prepared you are, there are certain statistics that have nothing to do with how prepared you are. Some of it's genetic. So I think one of the myths I wanted to go back to is postpartum depression. So the statistics show that postpartum depression can occur in 1 in every 8 women postpartum. That's an incredibly high number. So if you look at your group of girlfriends, maybe one of them have potential, if they've given birth, it's possible, even if you weren't aware of it, they may have gone through something like postpartum depression, never really talked about it. The other thing is that some people, there are myths saying that, maybe if you have like a better educational background, better resources, that postpartum complications may not happen to you. But there's actually a really shocking statistic that shows that college-educated Black women may have actually a higher maternal mortality than white women without college diplomas. And that just dispels that myth that having higher education does not necessarily preclude you from having postpartum complications. And there is another shocking statistic that I like to always share when highlighting this particular area is that postpartum, and especially for Black women, are 3 to 4 times more likely to have pregnancy-related risk and complications postpartum. And that's regardless of any sort of educational background and income. And when it comes to postpartum complications, it really can happen to anyone. And I think one of the big things is that it's important for us to be aware of what's normal and what's not normal postpartum. It's important for us to educate ourselves and our partners and those in our inner circle to keep an eye on us as we're going through this highly transitional period in our lives, to make sure that there aren't any warning signs that we're missing because we're so busy taking care of the baby at that point. And then one of the other things is self-advocacy. If you don't feel like yourself, you think something is wrong, please talk to anyone, someone, your friend, your family, or your health providers to try to figure out what's going on. One of the things we have to talk about is that some things that are peripartum conditions, medical conditions like preeclampsia, it actually can happen even postpartum. And that's one of the things that at January, we're focused on potentially, helping prevent in the people who are joining our program. So I just want to highlight that there's no such thing as high risk women. Pregnancy is a very high risk biological state, and delivery itself is a very high risk transitional time. For some women, it involves actual medical procedure of C-sections and other complications. So all women after delivery, postpartum, that recovery period can be a high risk period. And I really wish that for all women that it isn't, but the reality is that we have to make sure we watch out for complications.
Yeah, and I think you mentioned preeclampsia, which is a good segue to the next myth. Preeclampsia only happens during pregnancy and delivery, because we hear so much about it. Our providers and our OBs are checking up on preeclampsia signs. Brittany, I would love to hear your thoughts about this particular myth. What's your perspective on this?
I want everyone who is pregnant to know the signs and symptoms so they can be their own self triage. First thing to know is that it can happen for the first 6 weeks postpartum. Without any history of prior hypertension, it can still happen. Okay. We know about 5 to 10% of cases of preeclampsia are postpartum. So that's not nothing. 1 in 10, essentially. Delayed onset usually peaks around 3 to 7 days postpartum. So just to know, that's the top of the bell curve thing. Some symptoms of preeclampsia that you want to be aware of: severe headaches that come on and don't leave. We're not talking about the headache because you didn't drink enough and then you rested and it went away. We're talking about the headache that comes on. It's really annoying. It feels like that flu headache, and it's just persistent despite you drinking enough water, trying to take a nap, whatever. Vision changes would be another one. Right upper quadrant pain, right? Sudden onset swelling. So again, we are going to have some fluid changes postpartum, especially if you had IV fluids or an epidural. Those things are going to cause some swelling in your extremities. So that's important to know. But we're talking about I started a little swollen when I left the hospital. I came home and it reduced over a few days. And then all of a sudden we have rapid onset swelling again. And it's not what we would expect. And it's staying. That's what I mean by rapid swelling. And then of course, high blood pressure, right? Your risks of preeclampsia is higher if you have a history of a previous pregnancy with preeclampsia, if you have a pregnancy with multiples, or if you have certain chronic conditions. So I encourage that everyone has a blood pressure cuff, an electronic blood pressure cuff at home, so they can do some little triage, monitor themselves, know what the typical ranges are, talk to your provider about what they might be looking for. If we don't see anybody from 3 days postpartum until 6 weeks postpartum, maybe it would be nice to be able to check in if we had a headache. I love it when people advocate for postpartum, support from adjunct providers. So if you could have follow-up visits for between 7 and 10 days, that's great. And then when we are having these catastrophes that we were talking about and why our maternal mortality risk is higher, it's because we don't have enough support postpartum. This is the origin. This postpartum care is like the key that's missing. And so having that support postpartum is really important.
I just cannot emphasize enough that you are most familiar with your body. It's gone through an unbelievable shift and change. If something feels off, speak up. Ask the question, whether it's to calling your clinic, your primary care, OB, a partner like us, January, any other in the same space. Speak up and advocate for yourself. A lot of this happens because our focus, rightly so much on the newborn. We're learning a lot of new skills in real time, right? And we tend to put ourselves in the back burner and forget about what the changes that we just went through. And I think it's really important. I just want to emphasize that point again of speaking up and saying, this headache's not going away. Feels wrong. Let me talk to someone.
For sure.
Yeah, that's really
Shifting
important.
gears a little bit more, and but still on the physical aspect, one of the things that I think women are really focused on while they're pregnant is working out, exercising. And then we want to get back into it after we give birth because we want to feel, it's one of the ways we want to start feeling like ourselves. One of the common things that we hear is you can return to pre-pregnancy exercise intensity immediately after clearance. And typically this is at that 6-week checkup that you would have with your OBGYN.
Mhm.
For me personally, when I heard that, my first thought was, I do not feel like I can do any of the things I did pre-pregnancy. Are you sure I can do it? That was the first question I asked. What do either of you, Brittany or Lena, say to a myth like this?
Yeah.
I think that statement and that myth is more of a, hey, you can start trying. That's how I like to pose it to patients. You can trying to slowly get back into the types of exercises that you were able to do pre-pregnancy and probably most likely during pregnancy. So if you were exercising during pregnancy, these new moms and these women probably feel more comfortable easing back into that pregnancy exercise mode. But pre-pregnancy, that it was like 10 plus months ago, I think it's more just that it's okay to start trying. Your body is definitely not going to get back immediately to where you were, what you were doing, as you alluded to, Huei. And a lot of that has to do with hormones that are still at play. Immediately postpartum, there's a specific hormone called relaxin that kind of floats around your body up to 3 to 5 months postpartum. And that can affect your joint laxity, how stable you feel when you're doing certain exercise like lunges and jumping. And that takes time for that hormone to kind of dissipate postpartum for you to really feel steady in certain exercise positions that you may have been doing pre-pregnancy. This myth, I like to interpret it as, hey, it's okay for you to start gently moving your body and getting back into slowly getting yourself back into exercise and back into what you were doing kind of during the pregnancy before you felt too uncomfortable, and slowly progressing back to where you were pre-pregnancy.
For sure. Dr. Lena, this week I had a patient tell me that when we were talking about the hormone relaxin, she said, it feels like all my nuts and bolts are loosened. And I was like, they are.
It's a really good way to
They
put
are,
it. Yeah.
they are in fact loosened. And that is part of the benefit of being able to give birth, right?
Yes. I think it's probably necessary to be able to give birth, right? If it wasn't there and if things weren't loose, I think the birthing process would be a completely different and probably potentially more painful process, epidurals
sure.
aside. Yeah. I think one of the other things I always like to highlight is to give yourself grace in this postpartum recovery period. It's different for everyone. It looks different for everyone. There's a lot of social media pressure that moms are kind of back into that postpartum, that they bounce right back. And that's really not the case for a lot of moms. And I think the other thing is that if you're breastfeeding postpartum, if you had a traumatic or required a C-section, for delivery, this journey back to being able to exercise at your pre-pregnancy exercise intensity is going to take time. And that amount of time is individualized for everyone. Like the amount of recovery you need post-exercise is going to look different for everyone.
Sure.
Yeah. And everyone's emphasis in exercise is obviously with our core and abs because that was impacted the greatest. And especially, I think a lot about women who not just gave birth naturally, but if you had a C-section, you had a major abdominal surgery. Your abs are not going to naturally go back together just like that. Brittany, what do you say to women and how do you encourage them?
Yeah, what people are talking about is diastasis recti, which is the medical term for that. And it's just basically the two rectus abdominis muscles that run vertically in the front, and they're just separating. And obviously, they have to be able to separate to expand. There's a growing abdomen there. And then after birth, we hope that we have evacuation of the abdominal contents, meaning your baby, and that those things kind of fuse back together. But the reality is that 60% of postpartum women persist after that 6 months postpartum period without targeted support. So that's like the majority, right? We know that without intervention, spontaneous closure of this area past 6 weeks is unlikely, right? So what are the ways that we can increase closure of this diastasis recti? I'm going to talk about pelvic floor therapy, which I truly believe are the unsung heroes of physical support postpartum. If it was up to me, every postpartum person in America would have it standard of care. Everyone would have access to one. They would meet them prenatally for an appointment, and then they would also have follow-ups postpartum to react to any damage or work that needs to be done. They would help heal that abdominal separation. They would integrate these muscles and ligaments back together, and they would help balance these organs. And that can all be so beneficial. This can sometimes be done with or without an internal exam. Sometimes it's breath work, just balancing these muscles, and also appropriate exercise. Going back to, you're done 6 weeks postpartum, go out there, open in the wild and do whatever we want. No, a lot of times targeted support and what type of things we do. People think of crunches, right, as being the thing that's going to increase your abs to getting back together. And that's actually the opposite of what you want. You really want to work different core muscles, right? So moving forward, what I would want you to know if you were preparing for this or if you've had a baby recently, I would really encourage gentle core activation in the beginning under the supportive gaze of a pelvic floor therapist, right? And I would recommend connecting with them prenatally so that you already have this connection made and it doesn't seem like such a large mountain to climb. Postpartum, we're vulnerable. We're taking care of this infant. I want it to be, oh, I'm calling so-and-so and I've already met with them and that doesn't feel like a new thing to me. I also want to normalize pelvic floor therapy at any stage. I don't care if your baby's 5 years old. You can still go to a pelvic floor therapist. Your baby could be 20. Go see a pelvic floor therapist. Then obviously, if you have persistent issues past that time period with your pelvic floor therapist, they're a great resource. Maybe you're a person that needed a surgical approach, right? And doing that pelvic floor therapy and then having referrals to local providers is a great connection that you can have. That's not everyone. That's not even the majority of people. But if you're a person that needs some of that support, it would be great to do these early interventions and then be referred to the appropriate next provider.
Yeah, those are great pieces of advice, Brittany. And I feel like one of the things we talk about, at least when I see my patients in clinic, is sometimes a lot of patients ask me, what are Kegels? Am I doing this properly? Am I breathing in or breathing out? And this is where I also agree, I cannot stress enough, like where pelvic floor therapy will give you a good kind of feedback. Are you doing this correctly? Is what the internet telling you actually correct? And maybe you think you might be doing it correctly, but you actually may not be. And this is where pelvic floor therapists will be able to really help you, guide you through those motions of what to do at home.
For sure.
When we talk about pelvic floor, we hear the most about Kegels. I do think that there's a common misconception on what pelvic floor therapy is and why you need it. And I love, Brittany, how you tied it to the fact that it's actually going to help the core and ab separation and lower back issues, as well as your pelvic floor, and that every woman should really have a pelvic floor therapy or begin that not only during pregnancy, but during postpartum, and really even if your kid is 5 years old. I'd love for you to tell us a little bit more about what are some of the things that additional things that we can do at home to help improve our pelvic floor, in addition to the controlled breathing exercises? And I love the fact that you emphasize that crunches is not that's not the answer.
Yeah, going back to Kegels, because not everyone knows what Kegels are, right?
Mhm.
So let me back up. Let's talk about what that is. That's supposed to be contraction of the pelvic floor muscles to strengthen them. That's like what people think of. They're contracting just like they would any muscle, right? They're contracting so that they build that muscle back to whatever fitness level they thought they should be at. When the reality is that pelvic floor recovery is complex and Kegels often fail to restore function. In my clinical experience, most often the imbalance that's happening in pelvic floor muscular tissue is actually tenseness that is happening and not a laxity that is happening, right? So that's important to know. You're not strong, right? You don't need to increase that muscle. You actually need to learn the coordination of the different muscles in that area to be able to relax and then flex, relax and then flex. So it's not that anyone is weak and they need to necessarily increase that muscle tone. When you have muscles that are too tense and then you do more Kegels, you often can worsen pain and a lot of times urgency, like, having pain during intercourse or having to urinate frequently. Like you mentioned earlier, the pelvic floor is part of a larger system, right? That I think that's really important to highlight. This is your glutes, your hips, your back, hip strength, core activation, your breathing patterns. All of these were affected by having a very large center of gravity that changed. Strength does not always coordinate with function. So coordinating your breath, your posture, your fascial mobility, right? Being able to stretch, right? So things that you can do. I'm not going to give particular exercises. I'm not a pelvic floor therapist. And honestly, I would be doing it a disservice because I want you to go see one. But I would say that I'd advocate for you to see one and get attention that's tailored to you. Do full body movements, deep core things, break that recovery into a plan, right? We're really big into a plan here today. Know that healing takes time. And from a midwifery perspective, the add-ons that I'll add is that nourishment in this phase is so very important, that we're also healing at a cellular level, and that all of these things happen before Kegels are even on the list.
That's right. Somewhat related with the change in your body, it's a very common myth that breastfeeding is going to help you lose weight quickly. It's one that I hear a lot from women who are nursing, and even for women who, for personal reasons, choose not to nurse or cannot nurse. They want to talk about this myth. Lena, what do you say to someone who brings this up to you?
I feel like this is a common question that I get. They're like, oh, if I continue to breastfeed, will I return back to my prepartum weight more quickly? Speaking of changes in our cellular level, as Brittany was pointing to, I think one of the things that we have to remember is that the postpartum state is a constant state of change. So whether or not the mom chooses to breastfeed or doesn't choose to breastfeed, the hormones that are in flux at this state, whether which is stress hormones because you're staying like cortisol because you're up all night trying to take care of the baby and the baby's crying, sleep deprivation. So there is a lot of counter-regulatory stress hormones that are in play. All that potentially can make it harder for women to lose weight. And there's research that shows that 75% of women who at a year postpartum, regardless whether or not they choose to breastfeed, actually still retains some of their weight. And it's a little bit higher compared to pre-pregnancy. So if we think about caloric requirements for breastfeeding and what that all looks like. So if a woman does choose to breastfeed, they may burn about, 300 to 500 calories a day with breastfeeding. And it depends on like how frequently they pump and how much milk they're producing. But breastfeeding does also increase hunger signals. So that means that the woman is also eating more calories to try to fuel this breastfeeding process. And sometimes that balance works out. Sometimes that balance doesn't work out. And I think it depends on what other things are at play, like how well the mom is healing, if mom is able to kind of move their body and do exercise. So I think one of the things is that will breastfeeding potentially help you lose some weight postpartum? Yes. Is breastfeeding the answer for you to lose all your baby weight? No, absolutely not. And I think it really also depends on how well things like breastfeeding is going. And if once women return to the workplace at 3 to 6 months, that can really disrupt their breastfeeding schedule. So that can also come into play when it comes to burning calories and how that affects weight loss and getting back to that pre-baby weight. Any thoughts, Brittany, on this topic?
For sure. I love it. People sometimes do feel like breastfeeding helps them lose. And often they say, no, it wasn't until I finished breastfeeding that I was able to refocus. And that's such a common thing I hear. Knowing that that's normal, very important. Knowing that there's variation there, very important.
This ties to the next myth that we're going to bust. If Lena, you can talk a little bit about the hormonal changes that you experience, that a woman might experience physically and emotionally when she starts breastfeeding, and more importantly, when she's weaning or ending breastfeeding. Because I think there's so much emphasis and focus on the start of it, making sure the baby can latch, making sure you have enough supply, that I think we often forget that when we end breastfeeding and when we wean, you're going to go through another shift in your body as well. I'd love for you to comment a little bit on that.
Yeah, absolutely. So I think there's a lot of good literature about how breastfeeding itself the hormone changes that lead up to breastfeeding, the lactation hormone, prolactin, and how that's involved in breastfeeding. But at the tail end of weaning, whenever that process may be, whether it be 3 months because of a variety of restrictions going back to work, making a personal choice not to breastfeed, 6 months, or even 12 plus months, I think for most women with each wean, a lot of women will say, their mood changes. There's a lot of mood fluctuations. I think one of the biggest things is that people don't talk about is that you can actually get hot flashes or temperature sensitivity with each breast wean. And that can be shocking for definitely first time moms, or, oh my gosh, does that mean that you're going through perimenopause? Not necessarily the case, but it's because your estrogen and progesterone levels are now ramping back up. And these hormones are actually suppressed and potentially altered during breastfeeding because the prolactin hormone actually suppresses your body's ability to produce these hormones, which are usually involved in temperature regulation and ovulation. And that really ties into our next myth, which I'll talk about in a second. Any thoughts about your experience with the postpartum, the lactation, breastfeeding, weaning journey in your patients, Brittany?
Yeah, this is what I hear from people when I haven't heard from them in a while, right? They're graduated out of my care.
Yeah.
And then they come back and they're, whoa, you told me to look for X, Y, and Z risk factors. And we just weaned a week ago, 2 weeks ago, and I'm having so many emotions. My physical being is changing. I'm feeling really, I'm just out there, I'm not feeling grounded. And I have to remind them this is a humongous fluctuation. It's a little baby menopause, if you want to think about it that way, right?
That's a
A
good
lot
point.
of similar things. Yeah, a lot of changes happening there. And remember, a lot of times these relate to people's cycle, and we all know how hormones affect our cycle and how our cycle affects our hormones. So just imagine that times 10, right?
Which is a great segue to our myth, which is your period returning means your hormones are back to normal. I'd love to start with you, Lena, on this and what this means for women. And I think Brittany started commenting it, but if you want to add more to, go ahead. Lena?
Yeah. Brittany, I love that term, mini baby menopause. It actually really encapsulates what's going on with hormones as your periods return in the postpartum phase. For some women, periods can actually come back while they're breastfeeding, which is not the case for all women. And when your periods are during this postpartum period, hormones can really remain completely dysregulated for up to 12 months postpartum, especially when you're breastfeeding, and especially if the breastfeeding volume is on the larger side. When your periods come back, it doesn't necessarily mean that your hormones are back to your pre-pregnancy state. They're still constantly regulating, and as your body is healing, you may notice that you get one period at some point when you start to wean, or even before you start to wean, and then you may not get a period for a few months, and then at some point you'll get a period again, and then ultimately you'll settle back into whatever your menstrual cycle looked like pre-pregnancy, whether it was regular or irregular. And all of that really depends on your own body and what's happening at that time. Just because your periods are back doesn't necessarily mean your body is fully healed, is usually what I like to say.
For sure. There's a lot of evidence here of things that we have been presented with by society, and then what intuition and what our bodies are telling us postpartum. And I just want to challenge that pervasive culture shift that's happening for a lot of moms, because what we've been told and what we're experiencing but might not always align, right? So this is ever so present in the comment that you're making about the changes. And, it feels like I should be done. It feels like I should be feeling normal. And yet big changes are happening in our body, right?
Yeah.
And giving lots of time and attention is important there.
Yes, absolutely. And that kind of goes back to the first myth that we were trying to bust about how long postpartum really takes, right? So hormones can be dysregulated for up to 12 months. And postpartum recovery is actually anywhere from 12 to 24 months for most women. It takes time to allow our bodies to heal. And biologically, I think that our bodies are pretty smart. If when your periods are finally back to normal in that 12 to 24-month postpartum period, that's a sign that maybe your body is finally healed enough for potentially if you were thinking about trying for the next child, right? So our bodies are pretty smart. We have thousands of years of biology programmed into our body. And I think sometimes what society tells us that is those expectations are definitely not one size fits all. And in fact, if anything, societal pressures that women going back to work potentially may have contributed to some of these really short timelines that really don't make a lot of sense for a lot of women.
Yeah. So knowing that and have appropriate expectations for yourself, right?
Absolutely.
Yeah. And like, and this is a myth, but also a takeaway. If both of you can provide some closing thoughts on this, which is we hear a lot that taking time for yourself as a new mom is selfish when you have a new baby because you should be focused your attention on this new baby and all the new things that you're learning about it. What are some of your thoughts about this particular myth or misconception and some closing thoughts for women?
Yeah, I love to tell my patients a mother's well-being is the soil where her baby grows. So you're, as the mother, right, influencing your baby so much. So if you are feeling terrible, that will influence your baby. And we have mountains of evidence that shows this, right? Maternal mental health directly impacts infant development, attachment, long-term outcomes. This is a mother-baby duo. Two people have gone through something huge. So when you're the primary caregiver and you're also the one who's been going through something physically hard, a physical transformation, you both are still healing. From a clinical perspective, again, cortisol regulation, hormone balance, lactation, all improve with increasing self-care to the maternal unit, right? Since I could go on and on, but I'm not going to, I'll just say a reminder that motherhood was never meant to be a solo sport, right? Never. But we're often in today's society raising babies in isolation, right? And our bodies, our biology is wired for co-regulation. So we need this to stay balanced, right? That could be inviting someone to bring a meal, talking to somebody online, holding the baby when you shower, right? These are all like a sign of strength. That my hope for everyone who's listening is that we redefine what this strength means. And looking for support is definitely a sign of strength when you're postpartum, and we want you to be vulnerable. And building that support system that you deserve is extra important.
That's a great take-home message, Brittany. And I think one of the things you highlighted is that motherhood was never meant to be done in isolation. For generations and thousands of years, the societal form of motherhood was you had a village, you had grandparents, aunts and uncles, and like your partner side of the family all really coming together to help you out to raise this new human that you just brought into this world while your body is actively healing. So, at January, we really want to refocus what the modern village really looks like for women, especially in this modern era, especially if you're a career woman who's potentially going back to work or even not going back to work, because there's a lot of things that are different now. And here at January, we really want to be able to help and support that. And that taking time for yourself isn't selfish. You are also a part of the team and the recovery process. I always like to say if the mom is doing well, that means the baby inevitably will do well. So in terms of, kind of triage in the emergency world, you always have to first make sure that you're doing okay before you can take care of the person next to you.
It's also important to stress that recovery can take 12 months, it can take 24 months, not just 6 weeks. You may feel like you didn't need support the first few weeks, but you may need support or time for yourself later on when you have another shift and change. Baby starts moving around or you're starting to go back to work. And this concept of a modern village, I think, is again so important. It's evolved over time. And, this is definitely not a solo sport. Plus, honestly, it feels like you're technically in postpartum forever.
Yeah.
And the truth is, having information about these topics is not just enough. Like every myth that we've busted and talked to points to the same reality, which is your postpartum recovery is highly individualized. You need support that adapts to your specific situation that works with your particular goals. And this is not just your physical and mental wellness, but really also around your quality of life goals. And so, with all of the myths that we've busted, we hope that if you're an expecting mom, you now have more information and realistic expectations to plan with. If you're postpartum, you're not behind. You're right on track, even if it doesn't feel like it. And now you have the knowledge and more information to advocate for yourself if something doesn't feel right. Here's what's going to happen next. We just busted 12 myths. This was one of our expert panel series. We have a couple more that planned coming up, and you can see here the topics that we're looking to cover. So definitely subscribe to our expert series to get updates and information on what we're going to cover next around topics like mental health and pelvic floor. Do definitely explore our personalized planning and concierge support. We have limited spots available in our early access postpartum program. And before we close, I want to thank Lena and Brittany again for bringing your expertise, your knowledge, and your experience to help all of us cut through a lot of the noise and the confusion that comes with this postpartum journey. And with that, I just want to say thank you, everyone, for tuning in. And we look forward to seeing you all in our next expert panel series.
Thank you so much.